This legislation would foster the creation of public-private partnerships that harness philanthropic and other private sector investments so we can expand and replicate scientifically proven social and public health programs. It empowers states, local governments, not-for-profits, and the private sector to scale up evidence-based interventions that address our nation's most pressing challenges. It's this shift in focus from inputs to outcomes that could substantially transform our safety net to better serve our most vulnerable. Social impact partnerships address our moral responsibilities to ensure that social programs actually improve recipients' lives, and do so in a fiscally prudent manner. But they also respond to the imperative of improving our economic health by harnessing the capabilities of every able-bodied citizen. Our safety net must reflect our country's belief that, without exception, Americans are not liabilities to be written off, but instead assets to be realized. I think it's essential that we understand the purpose here is, of course, to pay for results. One reason we changed the title of the bill. But it's also to ensure that we learn from each intervention, each effort to replicate with fidelity a evidence-based practice across geographies, replicate it to another population. We know it's worked in Texas. Can it work in Indiana among a different population? So we can learn from our most optimal replications. We can also learn in those instances where we fall short. Over time, as we learn from these replications, both the most successful ones and those that are of lesser success, we improve the interventions. We improve lives in a more predictable way. So that we end up spending less money, so that we end up improving more lives, so that we end up achieving the shared goals that Mr. Doggett and I and everyone else on this committee so desires. And so this is a pilot program designed to tease out what actually works, and I believe it's going to be successful. It's going to create a mechanism where we can fine-tune the services we provide for people and not measure, frankly, our compassion based on the amount of money we throw at problems, but instead based on whether we're actually improving lives. And that's why I'm so proud we've got such broad bipartisan support for this. And